Let's bring in Wyoming Senator John Barrasso, who is also an orthopedic surgeon. Senator, tell us, I don't know if you could hear Blake Berman's report, but again, we heard it from Kathleen Sebelius. This is about messaging scare tactics about what the Republicans want to do in terms of repealing Obamacare without having a replacement there in the waiting. I wanted to get your response to that.
Well, it really ought to be about health care and patients, which as a doctor are the things that I'm focused on. As you know, this health care law has been so costly and so complicated that right now 8 out of 10 Americans think it either needs to be fundamentally changed or repealed and replaced, and that's what Republicans are promising to give patients what they need, which is the freedom and the flexibility and the choice to make decisions about what's best for them, not what big government thinks they ought to have.
Well, do you worry, though, about insurers stepping away from providing insurance to millions of these individuals if you repeal it and not have a very specific replacement there? If you repeal first and then you sunset that repeal over a period of 2 to 3 years, which is what's being talked about?
Well, a couple of things. First is, there really is no marketplace now for a third of Americans going to the Obamacare exchange. There's only one choice. You can only buy one thing. That's not a marketplace. That's a monopoly. And we've seen all across the country, prices have skyrocketed. Plus, the deductibles have skyrocketed to the point that even people who have Obamacare insurance can't actually afford to use it, can't get the care that they need from a doctor that they choose. So we need to take a different path. The American people have voted for that. You've heard the promises from the Republicans to repeal and replace, but it's been 6 years of malpractice by this administration. This is not something that you're going to be able to, in one day, turn around. It's going to take some time to get the power out of Washington, back to patients, physicians, and for decisions to be made at a state level. But we have to actually move right now, and we've done it yesterday with introducing our Obamacare repeal resolution to take out the most damaging parts of this health care law and the most unfavorable, which is, of course, the mandate that everybody has to buy a government-approved insurance policy.
Right, and I mentioned that I talked to Kathleen Sebelius, who ran Health and Human Services when the Obamacare legislation was passed, and I asked her about the repercussions. I want you to respond to what she had to say. Listen to this.
If indeed the Congress moves ahead, the Republicans in Congress, and repeals a law with no certainty about a replacement, and there is no replacement plan, I don't care if they say, we promise we will have a plan within the next 2 or 3 years, no insurance company will participate.
I referenced that, but I wanted to get your response because, again, sounds like that these Democrats are trying to scare the American people about what Republicans want to do.
Well, I agree with you, Dagan. These do seem to be scare tactics to scare patients, but patients know differently. They know that what Obamacare has done has broken all the promises that President Obama made in terms of raising costs, in terms of raising co-pays, in terms of keeping policies. All of those things have proven to be false. We want to make sure that patients have freedom and flexibility and choice. And it's not, to me, about coverage. As a doctor, it's about care. It's about making sure people can get health care. To have empty coverage doesn't do a lot for people. And as you said in that interview earlier today, over half of the people that they're counting have signed up for Medicaid, which is a program that is broken in so many states. If we want to help people on Medicaid, you need to let the states make the decisions of what's right for them, and that's why I'm so glad that Mike Pence is vice president, will be vice president of the United States. He knows as a governor and as a former member of Congress that there are things that states can do much better if the handcuffs are taken off so that they can make the decisions that work best in those states.
Senator, here's Kevin Kelly.
So, Senator, we know that the Affordable Care Act is ironic in name because it didn't lower costs, it didn't improve access, as well as, the benefits got worse. But what are Republicans actually going to do? What is the plan or policy to attack those three things that it failed miserably at? Because right now I hear repeal, replace, but I'm not hearing anything really substantive of how Republicans are actually going to do that. Are there certain plans that you can talk about or policies that will take effect?
Well, certainly, Tom Price has been nominated to be the Secretary of Health and Human Service. He's a physician and orthopedic surgeon, as opposed to Kathleen Sebelius, who you had on previously, who then at one time was a lobbyist for the trial lawyers. I mean, you want a lobbyist for the trial lawyers, and she's the one that wrote tens of thousands of pages of regulations that made Obamacare even more costly and more complicated. So now we have a physician in there who has introduced his own health care plan in Congress year after year about putting patients in charge, focusing on health care and getting the decisions to be made back locally. Let states decide what insurance qualifies as to be sold. Let people decide about what insurance is best for them and their families.
Will this include all forms of insurance? So is it going to open up the marketplace where people can buy disaster insurance? Because that's the problem right now. There's certain mandated insurance you have to buy, certain coverage you need. Is this going to legalize all forms of insurance?
Well, number one is it's going to eliminate the mandate that you have to buy government-approved insurance. In Wyoming, I hear from so many people who had insurance, it worked for them, and they lost it because President Obama said it wasn't good enough for him. He shouldn't be able to, Washington shouldn't be able to say what's good for you and your family. You ought to have the ability to make that decision for yourself, and those are the things that Republicans are going to continue to fight for. But it seems like from the interview with Kathleen Sebelius and what I've heard from Chuck Schumer and Democrats is they're not willing to work with us. They want things to fail. We want to actually provide health care for people.
No, they think it works except for prices. They really, the takeaway from speaking with Kathleen Sebelius is they don't really see anything wrong with what's done. You just need more government, not less. That was the overall
That's their
more
answer.
Government and less choice for the American people. That one-third, because she talked about the facts, and you mentioned this, Senator, about a third of counties have Blue Cross Blue Shield as the sole insurer, and in many instances where there is competition, the competition is a Medicaid managed care plan.
And we know that Medicaid in so many places doesn't work. One of the places that works the best is in actually Indiana, where Mike Pence, as governor, fought for and got a number of waivers from the government so he could do it a way that worked for Indiana. We tried in Wyoming to get those waivers. They were rejected. But with Tom Price as head of Health and Human Services, we think that we're going to have much more opportunity at a state level to help more people at a much lower cost, because then you're not dealing with all of these Washington regulations and mandates. So much of the cost is just trying to comply with Washington as opposed to actually providing health care to people.
Senator, great to see you. Thank you so much.
Thanks, Dagan. Thanks for having me.
It's going to